Welcome back to the Justice Factor. President Jacob Zuma and Health Minister Dr. Aaron Motsoaledi have launched the Phakisa project to upgrade all clinics in the country to provide top quality healthcare services. The Phakisa project, which means make it quick, has been implemented to develop ideal clinics and ensure that they are maintained. Yet, nearly every week reports surface of shortages of drugs, linen and other necessities at hospitals. Is Project Phakisa pie in the sky? My guest today is Minister of Health, Dr. Aaron Motsoaledi. Minister, welcome back. Is Operation Phakisa, given all the reports that we're getting, is it pie in the sky? Why do we keep getting more and more of these reports that, you know, drugs have run out, this clinic is turning people away, and so forth and so forth?
That is the more reason why we need Operation Phakisa. That's the more reason. Justice. But
this is, for me, the issue is, if you're working and you've worked as a medical practitioner, if you're working at Bara or at Jabulani Clinic, surely this is part of your work. You don't need to be told, oh, we have Operation Phakisa. From now on, you will be at work on time. It's your duty. You and I are at work right now, and we arrived here on time.
Yes, but if there are a sizable number of people who are not doing that, where problems emerge all the time, we need to look for solutions. For instance, one of the problems we are experiencing, which society is not aware of, they blame health workers. I've just told you that our HIV/AIDS program is now 30% of the global program. If you go back 10 years ago, Justice, there were only 400,000 people in South Africa who were on ARVs. Today is 2.7 million people on ARVs. You can imagine how many times did that number increase. But the number of health facilities, health workers, doctors, nurses hasn't increased at the same pace. So there ought to be a number of problems in that regard. So how do you solve them? We looked at all our clinics and their shortcomings and say we need an ideal clinic, and identify that an ideal clinic must look like this in terms of infrastructure, administration, the pharmaceutical, the procurement, financial management, and delegations, and put it up and say, we need to turn all our clinics to look like this.
But surely we should have known. It's like it's an ESCOM problem. We know that we are empowering many people. We're building more houses. We want my mother in Hammanskraal, my grandmother in Zanin to have electricity. Therefore, we will need more power stations. Surely 5.5 years ago when you came in, this should have been a priority area that these institutions have to work.
Well, it was a priority area, but done differently. And why Phakisa, Justice? Phakisa, the term is South African, but the concept is Malaysians. Malaysians argued, as you are arguing, that you should have known. They said in many governments around the world, not only South Africa, you have got plans, very good plans, but they are usually at 33,000 feet from the people. The people don't feel them. And they said in order to be at the level where people will feel them and they will change people's life, you need to pull them down to 3 feet. That's why the process is also called 3 feet. And they say you do that in what is called big, fast results. Now, in South Africa, we decided to call it Phakisa, but the Malaysians call it big, fast results. They say, unless you put together in a room all the people and stakeholders who are needed for that process to happen, all the old methods that have been used in the past are not working. Harvard University was so impressed with that in health that in May this year, they even invited the Prime Minister of Malaysia to address ministers of health when the World Health Assembly met to say, this is the method you need to consider because all of you have got grand plans, but they are always not implemented in a way they should.
Let me put it to you, therefore, that if all those people who work at your local clinic, at my local clinic, are not doing their jobs, and we can tell them as much as we like, but if there's no consequence that Aaron Motsoaledi will be fired if he is not providing the service, then it's not going to happen.
No, I accept that 100%.
And therefore you have to have a word with Nehau, for example.
No. In Phakisa, we build that in. In other words, if you look at Phakisa, we put about 120 to 160 people in what is called a laboratory for 6 weeks full. they divided themselves into 8 streams. One stream is working on procurement, the other is working on human resources, the other is working on financial management, infrastructure. In all their recommendations, they'll put something like that and say, for instance, on this one, if this and that happened, this should be the consequence.
I think the problem we're talking about in Operation Phakisa goes to the heart of the National Health Insurance Scheme that you've said you want to implement, that many people are saying you must implement. But all these things point to the fact that in terms of infrastructure, in terms of human resources, in terms of the fight against corruption, that the NHI cannot fly because of these problems.
No, that's true. That's very true.
Will it fly then?
No, that's very true. Even in the white paper, when it comes out, we have identified all those things and say, in order for NHI to fly, this is what needs to be done. In fact, if I have to summarize it, even in the NDP, the Peers Justice, it says, in order for universal health coverage to work, 2 problems in South Africa need to be resolved. There are many, including, some of them fall within this ideal clinic, but if you have to classify them, they fall into 2 main categories. The first category is that we've got a very high quality, well-advanced private healthcare system. But it's exorbitantly, the prices are exorbitantly high, it's extremely expensive, not reachable by ordinary people. Then we have got the public healthcare system, which saves 84% of the population, very under-resourced, very poor quality, with all those problems you are mentioning. Now, in order for NHI to happen, you need to solve these problems simultaneously. Make sure that the quality in public health
is it because you don't have real oversight over the provincial MECs? And the truth is that the MEC for Health in Gauteng reports to the Premier for Health in Gauteng. I'll give you an example of the Free State where there's no drugs, no beds, no ambulances. People are dying because of these problems. It's because the health MEC there cannot be fired because they report to the Premier of the province and not to you.
Well, there are many other factors. That might be one of the factors, but I will argue that it's not about who the person is reporting to. If people have got poor management, it doesn't depend on who they report to. It will always be poor. Now, in Operation Phakisa, and in the NHI, we put up all those things and say, if this happens, this ought to be the consequence, and the consequences should not depend on me. It can also depend on the Premier. It's written there because Operation Phakisa is under the President. You know, Justice, when the Prime Minister of Malaysia came to address us, when he introduced himself, he said, I'm the Prime Minister of Malaysia, but I'm not a politician. The President hired me specifically to make sure that I enforce these things, but he had to give me the power of being a Prime Minister in order for me to have the authority to enforce these things. So he said, because I'm a Prime Minister.
Stop you there, Dr. Motsoaledi, but thank you for the interview. We've run out of time. I want to ask you one key question. Are South Africans changing their lifestyles to suit the times that we live in? Am I getting fat? Are my neighbors, are we all eating the wrong things? Quickly.
Not yet. Not yet. That's why the issue is even going to United Nations. It's going to be one of the post-2015 World Development Agendas. The issue of non-communicable is to change people's lifestyle. They are not yet doing that. And we are putting regulations to make sure that they do.
Dr. Aaron Motsoaledi, thanks so much for your time.
Thank you.
After the break, our winners and losers of the week. Stay with us.